So for today, I'm going to go over some of the techniques that I use to do lip injections. So first, it's always really important to take a look at each patient's individual anatomy. What I like to do is always see how proportional the lips are at baseline. I then take a look and see where the patient's cupid bow is, as well as the body of the lip. I then also take a look and see what my plan will be for the vermilion border. So for this patient, she has a very nice lip shape. She has good volume already, but we could definitely enhance her vermilion border and cupid's bow and give a little bit of hydration and volume for the body of the lip. So I always measure along the vermilion border to see where my insertion sites will be, and I do my injections in a retrograde manner. As you get along to the cupid's bow, it is quite painful over here, so just bear that in mind. Try to be as gentle as possible. I still do retrograde manner for each one of these spots. Of course, you really do want to measure it so that way you don't have to do excessive poking, particularly in this very sensitive area. When you do the body of the lip, you'll see that I'm keeping it in a certain plane. You don't see the gray of the needle, but you also don't want to be excessively deep either. Again, it's supposed to be in a retrograde manner. Each time I'm injecting, I'm really not doing that much, maybe 0.1 to 0.2. The numbers actually don't matter. What really matters is how the lip appears when you're doing the injections. There are ideals for lip shapes and sizes. However, they really do not fit for all patients and all ethnicities. What I definitely do prefer, though, is for the bottom lip to be slightly larger than the top lip. The ideal lips usually have about 2/3 the size for the lower lip and 1/3 for the top lip. In certain areas, as I go deeper particularly, or closer to the inferior labial artery or the superior labial artery, I do aspirate. So as you could see over here, in this area, the superior labial artery could be present. So I aspirate for a few seconds, and then I do a retrograde injection. So part of the real skill is actually making sure that you fill in any of the deficits that have occurred as you put in the filler. So you make sure you feel around, make sure that there's no areas where there's a lack of filler, and that's when you could actually run into trouble because those could be visible later on. And then you want to massage to make sure that there's no lumps or bumps. Obviously, you don't want to do excessive massaging, but this is the time to really ensure that the lips are proportional and balanced. So I actually do my massage typically in the shape also that I want the lips to be in at the end. For this patient, I am using the newer filler, Reviness Versa, because it doesn't cause as much swelling as some of the other fillers. And this patient already has some very nice large lips. We don't want to cause them to be excessively large. If you like this video and want to see more videos, hit subscribe and also hit the like button. Feel free to leave any comments or questions below as well. Thank you, everybody.